Ladies and gentlemen, it's a pleasure to have you here tonight. It's a pleasure to host you. Thank you very much for coming. First and foremost, the world that we find ourselves in is changing rapidly. We have a number of technologies, AI particularly, data science, that are really changing the way that we operate. And Frampol, this evening, Frampol's objective is to really show you how we're evolving as a technology company. We've handpicked you to join us this evening. You're our key stakeholders in very key sectors, in a very key sector for us. We're looking at healthcare as having a number of very serious headwinds. Headwinds which include your clientele are very price sensitive and you've got increased competition. And you'll be under pressure and duress to attend to those headwinds with limited resources, limited time at your disposal, tighter and tighter budgets, and of course, do you have the skills in-house necessary to be able to deliver on this ever-changing landscape of AI, software development, and data science? In the last several months, the Frampol team have worked to capacitate our own business to provide these solutions. And we're going to touch this evening on our launch of Frampol AI. What is Frampol AI? It's an agent, it's an agentic platform within which we can provide solutions to your sector. We will look at your particular business. That's why it's a very small group this evening, because we're conscious of the fact that these are going to be turnkey solutions, custom-made AI agents that you'll be able to plug into your business in a matter of days/weeks, not months/years, at a fraction of the cost, at a cost that is palatable and with a return on investment that's measured in a very short period of time. So our objective is to be able to provide a demo this evening of Frampol AI, an agentic environment custom suited to your environment. We'll talk through that in detail. I'd really like this evening to be interactive, not a lecture. I really want this evening to be question and answer based. And although we will spend some time presenting, 5, 10, 15 minutes now, but really, please put up your hand and say, hey, can we have a bit of clarity on that? I'll be taking you through a few agents, a few agentic solutions that'll look at things like fraud detection, medical report writing, with the ultimate objective initially to demonstrate, number one, how quick to market we can implement this in your own business. Number two, to get the creative juices flowing. That if this is possible in a matter of days/weeks, what else is going to be possible? And this agentic solution is really, the agentic demonstration we'll go through tonight, which will be over 3 or 4 scenarios, will really demonstrate that the limiting factor here is our imagination. Not our ability to deliver, not the amount of time it takes to deliver, but your imagination to come up with the solutions to the pain points within your business. Focusing on a return on investment. We've heard that return on investment numerous times, but I want to touch on it. Low cost of ownership, and we'll be able to deliver operational efficiencies in a very short period of time. Your business is probably very similar to ours, is under pressure to employ more and more people, to do more and more tasks. With the advent of AI, there is no doubt that we can get software solutions to do that more effectively, 24/7, and far more accurately, and certainly with a cost benefit. And the objective this evening is really to demonstrate that with one motive: to get you into our boardroom in Highlands at the Frampol offices, for us to sit down across the boardroom talking about your challenges, your operational needs, your operational headwinds. That's the ultimate objective. A little bit of a background on Frampol. We've dubbed it Beyond the Wire because, as you know, you'll know us as an internet service provider, a solution provider in terms of connectivity. And we've been doing that since 2007, a good 18 years. We've developed cloud solutions. Many of you have got hosted servers sitting in our data centers. Many of you here are using our cybersecurity solutions, using our FortiGate firewalls, which are really government-grade firewalls and that have been protecting your networks for more than a decade. Your sector has certainly been one of our key verticals. We've looked after the health sector now for many years. And of course, with our strategic partners, Fortinet for our firewalls, Microsoft, which many of you are using, and just lately our partnership with Starlink, providing rural connectivity or remote connectivity seamlessly. And that's really a game changer. If I think of many of you, you've got ambitions, probably got branches, got expansion plans. Starlink is a huge enabler providing that connectivity. Why does it matter? Digital transformation is critical to the healthcare delivery. We're noticing that e-medicine, telemedicine, is becoming a key part of your sector. Your doctors are not present with your patients anymore. Your patient is remote, your doctor is remote. How do we enable that to be safe, secure, and effective? The sector faces challenges with security, compliance, interoperability. I was talking to Seamus a few minutes ago. The standards are critical. How are we going to adapt? How are we going to make sure that the industry as a whole is talking the same language? In the last few months, we've spun up a software development department. We've spun up a data science department, and we've spun up an AI department. Each of those departments on their own are ineffective, so we brought them together simultaneously. Software development without AI integration, I really think we're developing yesterday's solutions. Software development without data science plugged in is also a yesterday solution. Data, they're saying, is the next currency. So some of our team members who are here this evening are data scientists, software developers, and our AI team. That's really what we're planning on bringing to the market, bringing to you.
Go back on that. Can we talk a little bit more about the compliance, how we work with compliance in the sector?
Yeah, thanks, Brett. One of the key aspects of why have we developed Frampol AI is because the healthcare sector with GDPR, you can't be having patient data going into public GPTs. So the Frampol GPT, which we'll look at in a minute, is really a closed GPT designed with your persona. That's meeting GDPR standards. That's closed and meeting all of that confidentiality that's required, all of those standards. That'll all be bolted down in contracts when we engage. A very good point. Zimbabwe recently signing up with or pushing the whole data protection agenda. It's critical we tick that box. But I know that doctors and the healthcare practitioners are using public GPTs. Obviously, that's in breach of data protection regulations. So your private GPT called Frampol AI is really going to tick that box and will be designed with your persona. Each of your businesses have got unique selling points. Each of your businesses have got their own unique personality. They've got their own internal culture. The GPT will be designed with that persona in mind. So you're not just talking to ChatGPT and it knows a little bit about you, Foster. It's going to know everything that we put in about your business so that when your staff use it, you know that it's ring-fenced, it's firewalled, and it's got a walled garden. Thanks. This is a summary of what I've been saying. Internet and IT solutions, AI and automation solutions, data science and analytics, and software development. We believe that now is the time that we should automate as many internal processes as we can. We've started as our software development and data science team are working on Frampol. We are customer zero for that department at Frampol right now. We've reduced our invoicing time by 50%. 50% in the last 2 months. The amount time it takes to send out an invoice is reduced by 50%. Not only has it been reduced by 50%, but the human element in terms of errors, can you imagine how that's been reduced? Because you've got a piece of software doing it. Our business can now scale. And our invoicing team can now be busier on customer-facing issues, where we really need that personal touch. Let's get software doing what software is best at, and get humans doing what humans are best at. If we can offload a task, here's one. Right now, our software development team and our data science team and our AI team are working on our debt collection solution. Do you know we'll be debt collecting with AI agents? And that will be a phone call to a customer who owes us some money, and that will be a voice call to say, are you aware your account is overdue by this amount? Can we help you? Have you paid? Have we missed a payment? Doesn't get offended. You can scream at it, it's not going to scream back. It can have the phone put down on it, it's not going to have an emotional reaction to it. It can make 40 simultaneous calls at the same time. The way I look at that for our business is I don't need a human being debt collecting anymore. Our debt collector now, lovely lady, can now pick up the call when she needs to and build a relationship. But the actual debt collection process can be automated by an agent that has inflections in the voice, delays in the voice, sympathy, understanding, and can make 40 of those simultaneously. We'll probably bring some sanity back to her life at the same time.
Just another one on that. With these all being client-facing, can we white label those solutions?
Yeah, all of the solutions that we're talking about now, Brett, are not only white labeled, but they actually are given their own persona. They're given the culture. If I choose a PCD, for example, Prashant and his business has got a certain persona. They've got a certain culture, a certain way they deal with customers. All of that can be baked in to that AI solution. Not only for customer facing, but even for their internal staff. Imagine Prashant and his team employ several new employees and they want them to put them through training and get the culture of the business very quickly. He can put his team through that. So not only will that be customized to PCD, it'll actually be pcd.frampol.ai. That's what the portal will be called, seamus.frampol.ai. And that each of those will have their own persona. They'll have their own culture baked in, their own limits. Don't say this, do say this, have this kind of attitude, be aware of this kind of customer. Short answer, yes, but further to that, it will have its own persona baked in. Some of the use cases that we've looked at that Frampol have supplied in the last several years. Healthcare organization A deployed Frampol's managed internet and Fortinet solutions. What have we delivered? Operational efficiency by secure, high-speed, reliable internet. That's been obviously enhanced by not only delivering internet over fiber, but now putting backup Starlinks in. Fiber infrastructure has its issues with roadworks, with civil works, with graders. The next door neighbor doing some building and puts a wall in and cuts the fiber cable. Putting a Starlink in is just bolstering that, allowing us 99.95% uptime guaranteed in SLAs, by the way. Use case number 2, where we've delivered peace of mind to a clinic. We've taken their on-premise servers, put them into our data center, where they have reliable uptime, reliable connectivity, reliable security, provided them with peace of mind and allowed that organization, that clinic, to focus on their core business. Use case 3, health provider C implemented Microsoft Office 365 and Microsoft Defender to protect their network and their data. What did we achieve there? What did we deliver? Seamless, reliable communications across the organization. which was secure. One of the things we found is that doctors and their teammates may not be in the same office anymore. Alliance, you've got multiple branches, multiple colleagues around the country, some traveling, some local, some at branch in Alex Park, some branch in Borrowdale. How are you communicating? Sometimes the execs or the key members of staff are mobile. That email needs to be on their mobile device, both in the sent folder and the inbox. That needs to be fully synchronized. Being able to share documents with SharePoint, all of those are key solutions to operational efficiencies. And what we're really emphasizing here is if you don't and your competitor does, where does that leave your operation? Use case number 4, Health Insurer D and Medical Supplier E both deployed Frampol AI dashboards. What did it deliver? Fraud detection, improved claim workflows, and smarter inventory management. Hidden behind that will be cost reductions, because with less errors, lower cost, lower loss. Ultimately, they improve profitability. Frampol's local. We have a team all based in Harare. We're collaborative in terms of our solution implementation. We're consultative. You'll be in our boardroom. We'll sit and talk through the solutions you want to consider implementing. They are modular. They can start with a 1-week implementation cycle. We can then grow that to something that's slightly longer. Integrations with ERPs will obviously take longer than some of the smaller agentic solutions. I touched on that already. We have tailored packages. And yes, there's a mention there of free network assessments. Not only would you free network assessments to ensure that your infrastructure is stable of which to run these agentic solutions, but we'll even provide you with trials of these agentic solutions at no cost. Limited time trials, but trials within which you can touch and feel the technology and see if they deliver value. We're not expecting our customers to jump in feet first, head first, without touching and feeling this and being comfortable first. The objective here is to get those creative juices flowing and saying, what can we automate? Where can we cut costs? Where can we improve operational efficiencies?